Retraction extension of the neck is a very common repeated movement test I will use for patients with not only neck complaints, but also complaints in other areas where neck disorders can refer symptoms. That is, anywhere in the head, down into the mid-back, in the shoulder blade area, shoulders down to the fingers. Because it so often proves to be fruitful in resolving signs and symptoms, neck retraction extension therefore becomes the treatment for many, many patients. As testing and as treatment, the dosage is typically about 10 every few hours. We can perform retraction extension in sitting or standing, sometimes in prone, and sometimes in supine. Typically we're doing it in sitting, but not always. Retraction is different than retraction extension, which is also different than extension by itself. That combination to me of doing retraction of the neck followed by extension combined as one movement is, I think, where the magic happens. In Robin McKenzie's book about treating your own neck, which people can buy and follow at home to try to self-assess and self-treat, he has as exercise 1 cervical or neck retraction, which is just bringing the chin back in this type of fashion. Exercise 2, which he has some patients investigate or some people investigate at home, is retraction extension. So retraction followed by full extension. That wasn't an example of full extension, but it's not just extension. In rare cases, I have tested pure extension for patients' neck disorders. I can't recall a time where the fruitful motion was just pure extension, but it may happen that the patient doesn't like retraction extension, but the joints do like extension. In even rarer cases, I might go into protrusion extension. Obviously, there are other movements of the neck, like flexion and side movements, but when it comes to moving backwards in the sagittal plane, that combination of retraction plus extension seems to provide a secret sauce versus just doing extension. There are definitely a lot of patients, however, that just need retraction. For both of these movements, cervical retraction or cervical retraction extension, I'm typically getting to overpressure somewhat quickly, but for those who are more irritable, more vulnerable, we won't get to overpressure necessarily on day 1 or even day 2. We might need to add some assistance, for example, meaning what I've described before as training wheels to let the patient take the neck all the way back into full extension with less pain. But for most people, we're getting to overpressure quite quickly to help get to end range retraction or end range extension after we've already performed the retraction. So keep in mind that it's not pure extension. We do combine it with retraction, which I tell patients is kind of like stacking the joints of the neck first before we go into full extension. And to get the full end range extension of the lower neck, I'm typically having people lean back over a chair that's relatively low, hits them between the shoulder blades somewhere, so that we can really make sure by including upper back extension, we are really getting the lower neck to end range, because we want to investigate what happens when we do repeated end range movements of the spine to see if the problem in the neck is a mechanical joint disorder that will be resolved by moving repeatedly into a specific direction or not.